Most people wait until they're sick to see a doctor. But here's the problem. By the time the symptoms show up, often it's already too late. Studies show that up to 80% of chronic conditions are preventable, but only 8% of Americans get preventative screening. Most of our healthcare system is built around reactive care. So typically you don't see a doctor until something is wrong. And by then, it's more complicated, more expensive, and more serious to treat. It's like fixing a leaky roof after the storm rather than inspecting it before the clouds roll in. Now, of course, reactive care is essential. We will always need hospitals, emergency services, and specialists. But relying only on that is a little risky. And for many people, that's all they've ever had. Preventative care is the answer. It's about staying ahead of the illnesses rather than chasing them. We're talking about regular checkups, even when you feel fine. Healthcare screenings like blood pressure, cholesterol, cancer detection, or vaccines that stop diseases before they start, or lifestyle guidance, fitness, nutrition, etc. It's like doing maintenance on your car. You don't wait for the engine to fail. You change your oil, you check your brakes, and you make sure your vehicle's running smoothly. But here's the wild part. Up to 80% of chronic conditions are preventable with early actions and healthy habits. These are things like heart disease, diabetes, and even some cancers. This means fewer hospital stays, fewer prescriptions, and fewer missed days at work or school. It's not just good medicine, it's common sense. So if preventable healthcare is smarter, cheaper, and better for long-term healthcare, then why aren't we using it more? For a lot of people, they live far away from the clinic, they don't have a car, they need to take time off work, or they simply can't afford the visit. Imagine needing a 2-hour bus ride to get your blood sugar checked, or skipping a mammogram because the clinic doesn't have wheelchair access. These are everyday realities for millions of Americans. So people wait, they push through, they ignore the signs until something breaks. That's where mobile clinics change everything. Mobile clinics are like doctors' offices on wheels. They're vans or buses that are equipped with medical equipment and staffed by professionals, and they're designed to bring care where it's needed most. They park at schools, churches, farms, shelters, neighborhoods, and wherever people are. Preventative care that used to be out of reach is now just outside the door. They offer screenings, vaccinations, blood work, and wellness checks. Imagine a mobile unit visiting a rural town once a week, giving the residents the care and support that they haven't seen for years. Mobile clinics reduce ER visits, lower healthcare costs, and improve long-term healthcare outcomes. They turn healthcare from something distant to something local, from something reactive to something that's truly preventative. We don't have to accept a healthcare system that waits for things to go wrong. Preventative care saves lives, and mobile clinics make it possible. If you want to see inside a mobile clinic, I've got a great video that I've linked below. If you have any questions, drop them in the comments. We're always here to help.